Hello everyone, this is Dr. Simone Atkinson, and today we are studying chest tube drainage systems. So let's get to the point. The closed chest drainage system is used to restore negative pressure in the pleural space and treats various conditions like pneumothorax, hemothorax, and pleural effusions. And we have three chambers: the collection, water seal, and suction chambers. So the first chamber is the collection chamber, and this chamber connects the chest tube to the system, and it's equipped with marked columns, typically 3, which help us monitor the amount of drainage that is collected. So the water seal chamber, located in the middle, is filled up to a 2-centimeter mark with water, and this water serves the purpose of allowing air to exit the system while preventing its re-entry. And as the patient inhales and exhales, the water within the chamber moves in an up and down motion, which is known as oscillation or tidling. And this movement is observed through a tube in the chamber and serves as an indicator of the patency of the system. The suction control chamber enables the application of suction to create negative pressure within the chest, and this negative pressure facilitates the quicker reinflation of the lung by extracting air or blood or pus or effusion from that area of the lung. And the level of suction is established based on the quantity of water that's introduced into this suction control chamber. When it's in proper working condition, you'll observe a gentle and continuous bubbling within the chamber. Now, certain closed chest drainage systems, they utilize dry suction, which is adjusted by manipulating a suction knob to the appropriate setting. And both types of systems are connected to low wall suction via a connecting tube. However, it's important to note that the dry system does not exhibit bubbling in the suction control chamber, as it has no water, as it's only dry suction. Now, a Heimlich valve, also known as a one-way Flutter valve, serves as an alternative to the chest tube drainage system for specific ambulatory patients that are dealing with pneumothorax or a tension pneumothorax. And this valve enables the release of air from the chest cavity while preventing its re-entry. Also, there are safety measures that are incorporated on the valve housing, which ensures that they point away from the patient. Next, starting with the occlusive dressing maintenance, this step is integral to ensure meticulous application of an occlusive dressing, making sure it's securely anchored with wide tape or elastoplast at the insertion site. Now, should the reinforcement be necessary, the advice is to consult with the healthcare provider for guidance if there are any modifications that are needed to the dressing. Now, tubing connection security is important. That's a cornerstone of ensuring meticulous fastening of all the connections for both the chest tube and the suction tubing, and utilizing tape to ensure that the attachment is very secure. Now, this precautionary measure will ensure that there is no potential inadvertent disconnection or leaks, which could potentially lead to complications for the patient. Now, we want to allow gravity to assist with drainage, so a strategic approach is to position the collection chamber at about 12 inches below the chest level, and this would allow the gravity inherently to facilitate an efficient flow of the chest tube drainage. Alongside with that, maintaining the tubing in a straight alignment is also important to prevent impedance or any kinks or loops that could hinder the drainage process. Now, it's also important to do regular drainage monitoring and have a consistent, vigilant eye on the chest tube drainage with intervals of every 1 to 4 hours, and ensure that you report timely to the healthcare provider if you observe bright red blood, sudden drainage stoppage, or surges in drainage, or you notice consistent drainage levels exceeding 100 milliliters per hour. Maintain a consistent 2-centimeter water level in the water seal chamber to prevent low water volume, which can lead to excessive suction and potential damage to the pleural space. Now, assess fluctuations in the water seal chamber for the client as well. The absence of fluctuations might indicate issues like tube obstruction, loops, or kinks that would be required to be corrected. Or it could signify full lung re-expansion, suggesting the client's readiness or the tube's readiness for removal. Now, consider the client's condition and time frame for accurate interpretation. That would be done by the healthcare provider. Monitor the water seal chamber for continuous bubbling as well. Continuous bubbling suggests an air leak in the system that requires correction. And if the source of the leak is not yet identified, notify the surgeon. Intermittent bubbling synchronized with inspiration indicates proper tube functioning and the drainage of air from the pleural space. Ongoingly, monitoring is essential. Evaluate the suction control chamber to ensure that the correct suction level using the dial or the dry system or fluid level as necessary. So add sterile water if the level is too low, and take care to avoid excessive wall suction, which can accelerate evaporation. Now, to remove excess water, aspirate it from the rubber seal within the chamber. In a wet system utilizing water, the suction control chamber should exhibit gentle and continuous bubbling. Vigorous bubbling can lead to water evaporation without increasing suction. And while the absence of continuous bubbling won't harm the client, it won't provide the necessary suction for lung re-expansion. Assess the client's respiratory status, breath sounds, oxygen saturation, and comfort level every 4 hours or as indicated, and ensure the dressing remains intact, and be vigilant in checking for and reporting any subcutaneous emphysema. Encourage change in the client's position every 2 hours and promote coughing and deep breathing exercises. Be prepared for the possibility of frequent, even daily, portable chest x-rays to monitor the lung re-expansion. And avoid milking or stripping the chest tube unless specifically directed by a healthcare provider to do so, and you're also permitted by your agency to do so, because these actions can lead to changes in the pleural pressure and damage the lung tissue. Avoid clamping the chest tube unless explicitly ordered by the healthcare provider and permitted to do so by your agency policy. And keep the tube unclamped and maintain essential materials at the bedside, which would include occlusive dressing materials, petroleum gauze, sterile dry gauze, adhesive tape, and sterile water for use during emergencies. Now keep the tube straight and unkinked at all times. In the event of a crack or break in the drainage system, safely insert the chest tube into a sterile water bottle to restore the underwater seal, and subsequently replace the entire drainage system with a new one. If the chest tube is inadvertently pulled out, gently pinch the skin together to minimize the opening, and apply an occlusive dressing using the materials mentioned earlier, and immediately inform the surgeon for prompt action. Now moving on to the chest tube removal. This procedure is warranted when the fluctuation now stops in the water seal chamber, when a chest x-ray verifies complete lung expansion, as well as the client's respiratory status returning to normal or baseline. Now, essential materials include a suture removal set, petroleum gauze, dry sterile gauze or Telfa gauze, and wide adhesive tape. Now, if it's feasible, pre-medicate the client 30 minutes prior to removal of the chest tube, and instruct the client to follow the healthcare provider's instructions to inhale or exhale prior to the removal. Now, the dressing material should be opened and prepared just before the tube removal for a seamless execution. Provide support in properly applying the dressing following the chest tube removal, and ensure the wound site is adequately covered and secured. If it's advised by the healthcare provider, arrange for a follow-up chest x-ray, as this will confirm lung re-expansion progress as well as assess healing. Record the client's respiratory status after the chest tube removal, and maintain vigilance for any changes or complications. So that concludes the summary of chest tube management systems. If you found this information helpful, please give the video a thumbs up and subscribe to the channel. See you in the next video.